I'm going to go ahead and get started. Thinking about time. Good afternoon, everyone. Welcome to the Senior Dental Program Training for fiscal year 2026-27. Thank you all for being here and being part of this very important program and helping our seniors throughout Colorado. For those that don't know me, my name is Chandra Vitale. I am the State Programs Unit Manager. I'm actually presenting for Alondra Yanez. That's who you normally deal with. She's not able to be here today. I am also with me have Rick Love, our Administrative Assistant, and Taryn Graff, the State Programs Administrator. And they both will be helping me out today since I'm not used to doing these trainings any longer. One thing that you probably noticed when you logged in that we are recording this. This recording, since it is a training, will be put on the website. That way it will be able to be reviewed as a resource for you later if you need it. During the training, feel free to come off mute at any time. I'm one of those that prefer to answer questions throughout instead of waiting for the question slide, so feel free to raise your hand at any point. Next slide, please. If you're unable to hear us, please check your audio settings, which is kind of funny because you wouldn't be able to hear me say that. So clicking on the up arrow next to the microphone icon at the bottom of your screen, and that will assist you. Next slide. If you'd like to view captions or a transcript of the training, you can click on the Show Captions button or on the up arrow next to the button to select full transcript. Next slide. We will have both the chat and the Q&A pod available during the training, and you are welcome to use whichever you're more comfortable with. If you want to use the chat but do not want your questions seen by the entire group, you have the option to message only the hosts and panelists by selecting that option in the blue button in the chat. Questions can also be asked if that is easier than typing. If you raise your hand, we can take you off mute to ask your question. Cameras are not required at any point during the training, including when you are asking the question. Once you are finished, please ensure that you remember to mute your microphone once you're done. Next slide. During the training today, I will be reviewing the important dates, eligibility, Medicare Savings Plan, which you also see is the items. We have one sheet that I think we need to review a little bit more because there might have been changes, but we'll get to that. The fee schedule, billing, the annual report that is due every year by grantees, audits, and how hospital discounted care can tie to the senior dental program. Next slide, please. A couple of acronyms that we'll be using so you're aware of. HCPF, that is who we are. We do have a couple of brand new grantees with us this year. Department of Healthcare Policy and Financing. Medicare Advantage plans, you'll hear me refer to as MAP. Fiscal year, FY, date of service, and federal poverty guidelines. Important dates that you need to ensure to have on your calendar. Fiscal year 26-27 grant start date is July 1st, 2026. The fiscal year 2025-26 grantee annual report is due to HCPF by September 1st, 2026. Our annual report, when I say ours, which is going to be HCPF's annual report, is due to the legislature by November 1st, 2026. That is why it is important to have yours completed by September 1st so we can ensure ours is finished by the November 1st deadline date. Next slide, please. So we're having quizzes. Want to kind of see what your guys' knowledge is. When are invoices due every month? Is it going to be A, the first Friday of each month, B, the 12th business day of each month, C, the 15th of every month, unless the 15th falls on a weekend or holiday, it is due the first prior work day, or D, the last working day of the month? And give you a minute there. All right, an overwhelming C, it looks like. All right. C, the 15th of every month. Unless the 15th falls on a weekend or holiday, it is due the first prior workday. Great job, everybody. That was almost 100%. Next slide, please. As we just went over with a little quiz, invoices are due by the 15th. Following month, unless the 15th falls on a weekend or if HCPF is closed for a holiday, it is then due the first prior workday. So for example, if May 15th falls on a Saturday, the invoice would then be due on Friday, May 14th. The actual invoice due dates for each month are going to be listed in the fiscal year 2026-27 agreements for your convenience. We include these dates on your agreement so they're accessible and for you to have them on your calendars. Next slide, please. We want to see if there's any questions yet before we go forward. And for the new grantees or new employees, if I am going too quickly through these, just because we have some grantees who have been with us since 2015, feel free to say, hey, got a question, or ask me to slow down. So now we're going to go ahead and go into patient eligibility. Every patient of the senior dental program must be 60 years of age or over. The grantee must have a picture ID in the patient's file showing proof of their age. The IT must have a picture of the patient. A question we often receive is, what if the patient only has an expired ID? That is fine. Their age is not going to change. It's still going to be the same, even if the ID is expired or unexpired. So we will accept that. Please continue to use the full name and date of birth listed on the picture ID. This assists us when we have multiple people with the same name, for example, John Smith, that date of birth and if their middle name is listed on their ID helps us keep those patients separated along with their procedures. Next slide, please. Here's another question. I'd like to know if patients are required to sign a lawful presence form to be part of the senior dental program. Yes or no?
No.
All right, give us a minute or two more. People are still filling out. All right, we had 92% that said no. And that is correct. Due to Senate Bill 21-199, effective July 1st, 2022, we are no longer to check for lawful presence on anybody applying for the program. Next slide, please. Colorado residency. The And this is sometimes where the confusion comes in. Colorado residency is different than lawful presence. The patient must be a resident of Colorado to be eligible for the senior dental program. We have received questions about what to ask to prove patients if they're a Colorado resident. The only thing that really is required is confirmation that they live in Colorado and they plan to stay. That does not mean you can't ask for documentation to prove that they are a lawful presence. So you may request proof of residency, such as a water bill or utility bill, but the patient may also self-attest that they are a resident of Colorado and they intend to stay one. Again, grantees should not be collecting lawful presence documentation, as this is different than Colorado residency. If there's any questions on those, feel free to always contact us and we can work through that with you. But this has been a law since 2021. Next slide, please. A patient cannot be on or qualify for Medicaid program that has dental benefits. This includes, but is not limited to, Health First Colorado, which is the Colorado Medicaid system, as well as the Old Age Pension Health and Medicaid. We do now have other Medicaid programs that make it a little bit confusing, so I want to run through those. We have emergency Medicaid and family planning benefits. Those actually are okay for patients to be on. The emergency Medicaid is going to be if they are admitted into the ER, and all that program covers is ER procedures. It goes nothing past that. Family planning, I know, is probably kind of odd to hear when you're talking about seniors, but they can qualify for this program as well. This will cover items that have to do with family planning, along with other items within that realm of a program, which does not include dental benefits. So please have those marked on the side so you're aware if that shows up when you're checking on the web portal. If these two show up, they are eligible to still be on the senior dental program. Next slide, please. If the patient is 60 through 64 and they fall within the 138% federal poverty guidelines, they must have a denial letter from Health First Colorado showing that they don't qualify. The reason for this is normally, 99% of the time, when an individual turns 65, they actually are taken off Medicaid and put on Medicare. So under 65, they would be on Medicaid if they qualified. So once we look at your documents, say if we're auditing a file, we will look for that letter to ensure that this was checked. The person did apply for Medicaid and received a valid letter stating they did not qualify. The letter cannot cite any of the following reasons. The patient did not apply for medical assistance, the patient did not want medical assistance any longer, or the patient did not submit the requested documents. That is not a valid denial letter from Medicaid. That's showing that the patient actually did not follow through with completion of the application. Next slide, please. Checking at the web portal. Before I jump into this, I've received a couple of emails stating that individuals are not able to get on the web portal to check for eligibility. Those are going to be ones that have received delegated access from me. Our OIT has decided to remove my access, which in turn removed yours. If you are an individual that also, your entity that you are employed, or if you own a private dental office or whatever the case may be, and you currently check Medicaid, please go through that route to see if the patients coming through this program are on Medicaid. If you are a grantee that farms out your patients. So for example, a AAA, CGS, any of those, please ask your dental office if they can run to see if the patient is currently on Medicaid. I'm not able to get in the system at all at this very moment to check for that. If you come across that you don't have a way to do this, please contact us, and I will figure out a way to get this checked. If you do farm out, you can let the dentist know. Actually, you're going to receive more repayment from Medicaid if the person is currently on it anyway. So that should give them enough reason to check on that. But the web portal must be checked for all patients. It is suggested that the web portal is checked each visit. Some of you grantees do it, some of the grantees do not. That is your call. We do not mandate. I do ask that it is checked at least once a year. Reason for this is if you have an individual that for some reason did get put on Medicaid and we do an audit and find that out, you actually have to pay those funds back. So we just like it to be a little more careful on your end. The other thing is when you do check the web portal, do a print screen and throw that in the patient's file. We actually have had it in the past that the web portal for some reason was behind. So when I went in to check, it showed the person was on Medicaid. Contacted the grantee and said, oh, we got a problem. The grantee sent me their screenshot of the web portal showing that the person was not on Medicaid. So I did not force them to repay that back. They actually did their due diligence, did what they were supposed to. So it's a great reason to keep a copy of that in the patient's file. Also, I want to have everybody keep in mind that you can go into DentaQuest and check, but this is not the web portal. So if you have a print screen of DentaQuest in the patient's file and said, well, I checked for auditing purposes, that will not work. It needs to be the web portal. All right. Any questions? You all are being so quiet. This means you know everything. I love it. All right, next slide, please. So these are other health programs that qualify for senior dental. And a lot of you know these. This is going to be extremely important for especially these newbies coming in. You have SLMB, Specified Low Income Medicare Beneficiary Program. If you see that on the web portal, the person still does qualify because the state is just paying a percentage of a premium of their Part B Medicare. QI1, it's going to be the same thing. So they do qualify for the program. QMB, you actually are going to have two of those. You have the one showing on the third line that I'm on, and then if you look down at the bottom, there's QMB dual eligible. When you look in the web portal, the QMB for Qualified Medicare Beneficiary Program will show just that QMB. And that will tell you that the state is paying Part A and B, they do qualify for the senior dental program. If they are a dual eligible, which is a Medicare Medicaid QMB, and what that means is they actually receive full benefits through Medicaid, it is actually going to show full benefits through Medicaid. It's not going to show QMB dual eligible. So if it shows QMB and then full benefits, that means they're a dual eligible. If you run across this and you're not quite sure, just let us know and we can walk you through it because it can get confusing at times. I'm going to say 85%, 90%. It's pretty straightforward when you look at the web portal, but sometimes that 10% can be a little confusing. So feel free to let us know if you have any questions. Next slide, please. Okay, next we have the income eligibility. All income must be at or below 250% of the current federal poverty guidelines. The links to check the federal poverty guidelines are available on the Senior Dental Grantee website. Thank you, Rick. Rick just put that in there. Again, a patient must not qualify or currently have Health First Colorado or the old age pension. So just to throw that in there. Another thing, especially for the new grantees, everybody wants us to supply an application. And we don't have an application for this program. We wanted to make it as simple as possible. In fact, that was Senator Gonzalez's big thing is let's make it simple for the patient, simple for the grantees. So if you have a current application that you use, just go ahead and use your current application. Your screening form, I do want to state this, is your form. So it should not have the HCPF logo on it. Please do not go in and copy our logo from one of our sheets of paper and put it on yours. This is going to be yours. This is not the state's. And I think, did I just see a question come in or am I going crazy?
There is a question.
All right. Since we have many more people whom we deny who are on Medicaid than we approve for low-income senior dental program, we need to figure out a way to check eligibility without having to process people who are not eligible based either on their own lack of health, financial literacy. We would like to discuss how to work around. Okay. So why is my name on that? Is that you, Eileen? Since I gave you my link.
Yes, it is.
Okay. All right. So
and we can talk offline if this is only a problem for us, but we send a lot of people who we deny probably our denials for Medicaid. We probably deny 50 to 100 people a year, or deny them for the low income senior dental because they don't know they have Medicaid. And don't ask me why. It's one of the financial health literacy things that I'm trying to work on at this point in time on a different project. But I don't want to send people to the dentist and then have an expectation that they're going to get services. And when they get there, they may or may not get them.
Okay, so quick question. I would assume that the dentists, if they accept these program rates, they accept Medicaid as well. So wouldn't they be able to help them? I guess I'm just trying to wrap my mind around it. I'm not second guessing you. I'm just
it's the admin work on our end.
Got you. Okay, I get it. Got you.
So, and you and I can discuss it offline unless the area agencies on aging and some of the other organizations have it. We could still discuss it offline.
Okay, can you hold this and then bring it up at the very end? Because I assume we're going to have time.
Okay.
Thank you so much. Okay, thank you. We're getting a couple of questions in. I want everybody to ensure that you have copies of the documents that you're using for your income in the patient's file. When we audit it, we will run over that to ensure that they do qualify for the program and they are at or under that 250% of the federal poverty guideline. Next slide, please. So this is the kicker, is they actually, your patients may self-declare. This is one of the items. Some may have come across these patients. They live by themselves still, starting to have a reduced mental capacity, starting to forget things. They can't find their documents. They need dental work. It's kind of like, what can we do here? They can self-declare. I do ask that whether you type it up or they type it up stating that this is our income, this is an accurate account, and have them sign it. This actually makes it where you've done your due diligence, and if they are not being truthful about what they currently make, then the accountability goes back on the patient and not to the grantee. I hate to say it, but I have, since we've been doing this program 2015, there has been a total of 2 outright fraud patients, which I guess for me, you don't expect somebody that's older to do that, but it does happen. So I do caution self-declaring income across the board for all patients that come in. To me, you need to try to find out what that income is. Any questions on that? I know that can be a harder one, especially if the individual is reduced mental capacity, they live by themselves. It can be kind of a line that some people don't want to cross, not wanting to ask for anything. Please note if something like that ever happens, and if you have questions, especially for the new grantees coming in, we're always available to walk you through it. Next slide, please. So this is the bane of all of our existence. MAPS. It was great that we were able to, oh, Michael, you are one of our new people. If, Rick, if you could throw in our email, please. For the senior dental program, that would be great. This is going to be the email that everybody will need to reach out to. It's not a personal email. It's actually our inbox for the senior dental. That way we have numerous people that are looking at it. And your question will be answered if Alondra is out of the office. So on the Medicare Advantage plans, many patients don't realize that either 2 things, that they have dental embedded in their Medicare Advantage plan, which I know that they last year or 2 years ago started reducing dental again through Medicare. So they might have, say, some x-rays they can get done or cleanings throughout the year. If the dental is embedded within the Medicare Advantage plan, they can still be part of the program. They don't have an option. So this is the reason that we decided to go ahead and add this in with the program and allow them to be part of it, because when they got the plan, they couldn't have the option to say, I don't want the dental in there. Now, if they are paying an extra supplemental past that Medicare Advantage plan, which means they have that payment and then they have another payment that they're making to receive extra dental, they can no longer qualify for this program. Just received, many of our patients do not disclose that they have insurance or do not have their insurance information. What is your suggestion for these patients when proof cannot be given at the time of sign up? Well, if they say they do not have their insurance information, they've already told you that they have it. So you let them know, once you give it to me, then we can go ahead and proceed. If they do not disclose it, all you can do is ask for that Medicare Advantage plan card, take a copy of it, ask them the question. If they receive any extra supplemental, or if they don't have Medicare, do they have extra dental insurance? You've asked the question, you've done your due diligence. That's when we have a problem, is when grantees are not doing that, when they are just taking in seniors, not asking the question or doing a little bit of investigation. If you've done your due diligence, it falls back on the patient. And that's probably, I wish I had a better answer, but I don't. And it's just because trying to find out information from a map is so difficult at times that we just ask you to do your due diligence, and that's all you can do. Any other questions with this one? The maps can be really sometimes very difficult to navigate. How can we confirm if they are or not paying for supplemental? Patients don't know if they, like what I just answered, Sylvia. You ask the question. If they don't know, you can investigate, which we've talked about this before. I think we were emailing back and forth. You might have to make a phone call. If they say, no, I'm not paying for an extra supplemental, then you've done your due diligence. You've asked and they've said no. I have, and I'm not sure who the grantees are. I know I have seen applications in the past, and it looks like they've actually developed an application just for the program. So it asks specific questions, and one of the questions is, do you pay an extra supplemental through MAP for dental? And if the patient marks no, and then we find out that they do, then that absolutely falls back on the patient. We have another question here. We have patients that are devoted MAP and have dental coverage. According to this MAP, they have to pay for services in full. Patient gets reimbursed 50% from devoted, but they also call, how do we handle these instances? We actually will talk about this a little bit more once we get to the invoices. So just hang on for me, Angela. Great question. All right. I am going to go ahead and proceed. I know that's not going to be all the questions for MAP, though. Next slide, please. All right, hospital discounted care, which has absolutely nothing to do with senior dental program. And why am I bringing this up? This is a law that started in September of 2022 that provides protection for low-income individuals related to how much they can be charged for hospital services. It happens to be 250% of the federal poverty guideline. We do, when hospitals fill out the application for these patients, there's actually a card they can give them. If a patient says, or if you even want to ask, do you have a hospital discounted care card? That automatically tells you if they have an unexpired card that they are at the income level they need to be, and they automatically qualify for the income. The only thing you need to check are two things. You need to ensure that they're 60 and over. And if they are 60 through 64, they still need to provide a Medicaid denial letter. But other than that, you don't need to check their income because that has already been done through hospital discounted care. If you remember the last couple of years, we had it with CICP, which was the Colorado Indigent Care Program, that actually sunset. So that's no longer out there, but hospital discounted care is still out there. So helps you a little bit with time if they present this card. Whoa, next slide, please. And I just went through all of that, so my apologies. Please remember it needs to be unexpired because those cards are good for 1 year normally, and then they have to get redetermined after that point to ensure they still meet the income guidelines. All right, next slide, please. This is actually what a hospital discounted care card will look like. One thing I want to point out is with this arrow, it says hospital discounted care. That's what you want to look for. If it says internal charity care program, you then will have to check their income because some hospitals, their internal charity care will go up to 300, 400% of the federal poverty guidelines. So it has to be under the hospital discounted care. Next slide, please. So we have quite a few federal qualified health centers that are part of our program. And we have quite a few FQHCs, which is what we call them, that give out cards for their patients. FQHCs provide discounted service to patients that are at or below 200% federal poverty guidelines. So these individuals actually would automatically qualify because for those services, they can't be on Medicaid. It would be a separate. So if you have one of those cards, you would need to check to ensure that they are 60 and over still, because that is not done by the FQHCs. Just got a question in. Do we need a denial letter from patients who are not lawfully present? Well, you're not supposed to be checking for who's lawfully present. So you would need a denial letter from someone who is between the ages of 60 and 64. All right, any other questions? Okay, next slide, please. The fee schedule. The current fee schedule is always available on the Senior Dental Program website. Updates on the Senior Dental Program fee schedule can occur throughout the fiscal year if they're recommended by the Dental Advisory Committee and are approved by the Medical Services Board. The only way we would be able to do something throughout the middle of the year is if we deemed it an emergency, and then we would make a change. If not, we're just going to do it once a year. Stakeholders, you grantees can always suggest, hey, can we add this procedure onto the fee schedule? As looking at the fee schedule, we offer much less than what Medicaid does. So if there's a procedure, you're like, we have so many seniors coming in and this would be really helpful to have it on the fee schedule, send it over to us. Once again, to the HCPF Senior Dental email box, and we will review it and we will put it on the agenda for the Dental Advisory Committee to discuss. There will be a new fee schedule for fiscal year 2026-27. I want to kind of run through this a little bit. Can you go to the next slide, please? Thank you. This might be old news for the current grantees, and maybe old news as well for the new grantees. We did have a grant reduction for this year, for the fiscal year 26-27, of $2 million, which means our grants were cut in half. This is due to the current state budget emergency that we are having. These are general fund only monies. So that means they can be cut at any time. So we consider ourselves, and many grantees as well, very lucky that the whole program just didn't get cut, because that did get brought up, and it was saved though. At our last Dental Advisory Committee, it was brought forward about changing all the current rates to match Medicaid. By doing this, we would actually be able to help 600 more seniors in the year, even with having that reduction cut done for this year. So we did our thing, folks, and had the documents and what Dental Advisory Committee recommended sent through. We have found out that the Medical Services Board has approximately, what is it, Taryn, 12 things on the agenda?
Yeah,
And
12. We had 12 and 2 that are pretty contentious. So
there is actually a item on the Medical Services Board's website about the contention that's going to happen. So they asked if we could wait until July to bring those changes through. I mean, in a sense, it's a good thing we're not going to be in the middle of the mess, because it's going to be pretty, I don't want to use the word bad, but there's really no other word for it. So this is what's going to happen. Since we need to take these to the Medical Services Board July 10th, instead of the rates being valid effective July 1st, it won't be until July 10th that they become effective on the new rates. So I have worked with Taryn, my Excel guru, and she has went into the invoices that we will be using for fiscal year 2026-27 and has wrote the formula inside there. So you guys don't have to do anything. You just need to fill out the invoice like you normally do. The difference is going to be if you enter anything for July 1st through July 9th, that rate is going to be different than the July 10th and onward. You will have the old rate July 1st through July 9th and the new rate starting July 10th. So there is nothing that you need to do. Yes, thank you, Taryn. So I know it won't be a huge cut into what we were hoping to save, but I think it saved a lot of work, not only for Medical Services Board with what they're going to be going through, but we can have ease of ours being heard without a whole bunch of contentions around us. So any questions on that?
Chandra, the only thing that I wanted to mention is that because we had to tie those to a date of service, now you will not get the rate to pop up in the invoice unless you have both the date of service and the procedure code filled in. Before, if you just put a procedure code in, it would pop up with the rates. But since that is based on the actual date of the service now, you do have to have both of those pieces of information before that the rate will come in.
Great, thank you so much.
And we had a question in chat there too, Chandra.
Oh, Catherine, good question. We were talking about this. If there's a service missed in June that goes to the July invoice after 7/10, it would be paid at the rate after July 10, correct? Okay, Catherine, can we hold off until we get to the invoice on this? We actually are talking about it. We're going to have to do some special stuff for these. So yeah, we'll get to that. It's right when you think you have everything worked out and then this question popped up. It's like, oh boy. So we'll get to that. Thank you for the question. Great one. All right. Anything else on this? Okay, next slide, please. Again, as we already went through, invoices are due by the 15th of the following month. You will notice on the, and I will be pulling up the Excel to run through it, especially for the new grantees that are here, what that looks like and how that is done. That the senior dental program will pay no more than the max program payment listed on the fee schedule. And so all of the max payments are actually hard coded into the invoice. So it will not allow you to pay more than what it states. It also has, it automatically pops up with the 15%. So let me go ahead and share my screen so I can show you the invoice. All right, can everybody see that? Karen, Rick, are we good with that?
Yes.
Okay, perfect. So let me go ahead and just start all the way over down here at the bottom. If you go to the first tab, that's actually going to be invoice instructions. What needs to go there for new individuals, new employees, or new grantees. This will explain what needs to go there and how it needs to be entered. This here are procedure codes. This way you don't have to keep a running list somewhere else. Just put it there for your convenience. This is going to be the summary page. This is going to show who you are. And down here is the most important thing, the original amount awarded, and then a running total of what your remaining grant amount is. So let's go to July here. I went ahead and threw in some procedures already. So first of all, to talk about the change of the old rates and the new rates from July 1st to July 9th, and then the new one starting July 10th. If you notice here on D022071 is brought up as a max program rate is 25. And then July 16th, same code is brought up as $13.21. So that is automatically going to fill in for you with that date of service. And like Taryn had mentioned, let me go ahead and do this. Let's go ahead and put in D, I don't know, 0180. Nothing is going to show up because you're going to need that date of service because the program doesn't know what to look for, the old rate or the new rate. So once you type in that new rate, then it'll be able to fill that in for you. And I'm going to get to yours here in just a minute, Catherine. So for new individuals, we have quite a few grantees that charge less than what the max copayment is. So let's say that you did the, let's do complete denture. So the max program payment is showing as $851.41. If you notice, no co-payments have been uploaded automatically in here, and that is because not all of our grantees charge a co-payment. It's going to be up to you whether you charge it or not. If you do charge it, it cannot be over the max co-payment amount. So let's go ahead and put in 90 because that is over the max copay amount. That will red line, that will show you that you are over the copay amount. And so it will not add an amount in here to bill us. So you need to make sure to watch out for those. I put in 80, which is the max, and now I added it in there. If you do not charge as much, and that's one thing I want to stress, is if you normally charge $600 for a denture and we will pay $851.41, please don't charge the full $851.41. Charge what you normally charge your patients. These are general fund dollars only that many seniors, and we don't have enough funds, especially now with this $2 million budget cut, that need these funds. We also had a cut in the current fiscal year 25-26, by $500,000. And it may not seem like a lot, but we do have some grantees that were in the middle of treatment plans, which means a person may have received extractions for a complete new pair of dentures. They were in the healing process, and you can't bill us until the service is done. So they were getting ready to do the service on this individual, and they are now out of money because of the budget cut. So please only charge us what you normally would charge the patient. That is just a ask from myself and every other senior that needs assistance with the program. All right, now let me get off my soapbox. So you charge less, you charge $600. You would put $600 in this column right here. That actually overrides, and now $600 is the amount that you are billing HCPF, because that is the amount that you normally bill for those dentures. Any questions so far? I can't see. Do we have anything there, Rick?
There is one in the chat. Or there's two now. I can read the first one. It says, if a patient has a MAP dental plan, but our clinic is out of network with that plan, are they eligible for the senior dental program?
Ooh,
If so, do we have to bill the MAP dental plan first?
great question. And that slide's coming up. So I'm asking everybody to hold. I apologize, but I actually have the answers. And what's the next one?
Yeah, the next one is, where can I find the fee schedule? And
Rick will put that in there for you. You all, when I say you all, grantees have a grantee website that has everything imaginable that you would need, even the rules. It has the link to find out the federal poverty guideline. It has everything you should need. And in fact, once we're done here and we get towards the end, I'll bring that up for everybody, especially for new employees and the new grantees, so you can take a look at that. Catherine, talking about billing from June. So the only time that we would accept billing from June on July is if it was for a Medicaid Advantage plan, a MAP, that was previously billed, and we'll go more through this. I just don't want people to think, oh, I can bill June onto July. No, we don't cross fiscal years. That's not allowed. If you forget to put something on the June invoice, you will not receive payment once the fiscal year ends. It's a done deal, and we'll go more through that. So the only thing that we have figured we will be able to do is you will need to input whatever the said item is for this patient onto the invoice and then send us an email. And what we will need to do, you'll have to include the date, because we want the service date from June, because that is when you did the service, you billed the MAP insurance. So we need the correct date. We will need to go in the system and upload it so the correct amount will show from the previous fiscal year. So there unfortunately is no other way around it. Thank goodness we don't have very many of those, but that's the only way we can figure that we would be able to do this, especially to make it less administrative burden on you all. So does that answer it? Okay, perfect. The 7% for new employees and individuals that are new grantees, this you can actually delete out and not take it. The reason for this is because we do have some grantees that do not charge the 7%. They actually have it go back into the services they give the seniors. So instead of taking it for administrative reasons, they use it for procedures on the seniors. You will notice with over here, let me add that back in. Let me click here. You'll notice over here that it shows the amount that we have put in so far. So the $696.46 is the same as this. 7% is the same as this. And then the 49 is what is remaining. after you minus this out. If you go back to your summary, you'll notice that whatever month you are on, if you go back, this is going to match exactly to what you have filled out with all your months. Any questions so far on that?
Rhonda, we got a few questions throughout the year about why that number was the same across all of the tabs, or confusion about why it didn't match what we said was remaining in that month. So I just did want to point that out, that like Chandra said, that is going to be remaining amount regardless of what tab you're on. That's how it is set up. So it's not going to be the remaining amount after you put in July, and then the next one will be the remaining amount after you put in August. It's going to change with everything that is put in for each of the tabs, not just with the individual one. If that makes sense.
Thank you, Taryn. Maybe we can put, when we go to send these out to everybody, grant amount remaining running total or something, to make that a little more understandable for grantees, especially new ones, new employees. So that's something that we definitely can look at. Thanks for bringing that up. I think, I don't know if I want to go ahead and go forward. Let's go ahead and get back to the PowerPoint, Rick. And then we might have to come back to this, and I'll share my screen again. Do I need to stop sharing?
If you could, please.
There you go. Perfect. Okay, if we can get to the next slide, please. All right, this is a huge thing. The procedures must be completed before billing the department, before billing HCPF. What will happen is there is a chance that if we are auditing a file, we go in and we see the procedures were actually billed to us prior, that we would require that amount to be paid back. And the reason that it was done this way, if you remember, when you filled out the grant application, we always check for financial viability. This is why, is we need to ensure that you're financially viable to cover these expenses until we pay you. We don't wait months to pay you, but you need to be able to bill us after the procedures are done. And so lab fees and stuff like that can be expensive, especially when you're talking about dentures and stuff. So that is, that's a big one there. The other one, as a reminder, I already said the 7% administrative fee, that is up to you, whether you want to charge that or not. I do want to state that if you submit your invoice and it says 7%, you're going to get paid the 7%. If you don't normally charge it, you're still going to get paid the 7%. Whatever's on that invoice, you will get paid unless we remove it because we find a procedure that has already been billed and it doesn't meet the guidelines of how long the time has been since the other one that you had done or anything like that. We will change that. But if you add the 7% in and you don't normally charge it, you will get paid for it. So I just want everybody to be aware that we will not go in and just remove that because that's what we are used to seeing from you. Next slide, please. All right, this is the question. I'm not sure. I think this might have been from Terry. Billing and maps. So if you currently have a contract with that insurance company that's through that Medicare Advantage plan, if you have a contract with them, then you have to bill them. So let's go ahead and use, I don't know, United Health. I'm just pulling these out of the air here. You receive a patient, they have their Medicare Advantage plan through United, you have a contract with them that you're able to bill them, then you have to bill them prior to billing the program. Now, let's say you have another patient that comes through and they have their Medicare Advantage plan through Cigna. And like I said, just pulling this out of the air. You do not have a contract with Cigna and you're not able to bill them because you don't have a contract with them. You do not have to bill Cigna if you do not have a contract with them. So you can bill everything directly to the program. Does that answer your question, Terry? Perfect. Okay. Now this is going to be the same. Make sure I got everything on here. Next slide, please, Rick. So for individuals that farm out the dental work, and this is going to be for like the AAAs, CGS, if the qualified provider that you are using for the dental work for your patient for this program, the same rules apply. If they have a contract with that insurance company needs to be billed before we are billed. And same rule apply if they are not able to bill because they don't have a contract with them. They don't have to bill. The entire bill can be sent to the program. Are there any questions with that? I always like to take a little time here because a lot of times we have, and if it's quicker for you to come off mute and ask over typing, please let me know. Just raise your hand. Okay. Next slide, please. Quiz time. Are you able to put a previous fiscal year procedure in a current fiscal year invoice for a patient who does not have a Medicare Advantage plan? And I'm going to give this one a second here for people to fill out because I can see a little going back and forth. And this one, sometimes people have a minute to get every year. All right, looks like people are still filling in. All right, 94% said no. I'm going to go ahead and the answer is no. If you have an individual that, let's say that you, oh, God forbid, if it was a high amount like a crown, you did a crown in June and July 3rd comes around, you're like, oh, or I'm sorry, August 3rd comes around. Shoot, Chandra, we forgot to put this on the July invoice or on the June invoice. Can we put it on the July invoice since we forgot about it? Absolutely not. Since this is general fund dollars only. And Rick, can you go to the next slide, please, while I'm talking about this? My apologies. Since this is general fund dollars only, the funds that we have left do not cross over fiscal years. If we don't use them, we lose them. Actually, the state takes them back. So if you forgot to bill something, you actually would not receive payment for it. And you absolutely cannot go back to the senior and say, you need to pay this $500 bill. Because it is not the senior's fault that you did not follow the process. Any questions on that? Now, I want to stress again, we are talking about procedures that are not part of a Medicare Advantage plan. Okay. Next slide, please. Now let's talk about Medicare Advantage plans billing crossing a fiscal year. This is going to be different. If you're a grantee and you bill an insurance because your patient has a Medicare Advantage plan, and let's say that you bill them on June 28th because that's the date of service, and they decide to finally get back to you August 2nd, oh, here, this is what we paid, and you have $200 remaining on this procedure that you need to bill us. You would put in the date of service, which would be that June 28th in the invoice, and you would need to ensure that you upload all of your information into your SharePoint site that shows when the Medicare Advantage plan insurance company was billed, what you received back from them of what they paid. We have that, we will pay the bill. If we have no proof that the insurance company was billed prior to the end of the fiscal year, we will not be able to pay for that procedure. It's imperative that you all know that. Are there any questions on this one? You can go to the next slide, please, Rick.
Chandra, we had that question earlier about the devoted map plan.
Oh, I thought I
think we
answered. Yeah, did I not answer that? I thought I did. Because I thought, was that by Terry?
No, it's Angela.
Let me get up to Angela here.
The question was, we have patients that are on a devoted map and have dental coverage. According to this map, they have to pay for services in full, and then the patient gets reimbursed 50% from devoted, but they also qualify then for senior dental, and how do they handle those?
Angela, I'm going to ask you if you can actually come off mute because I have some questions. I guess I haven't heard of an insurance company that is requiring the patient to pay everything in full before they will pay it, especially if this is through Medicare.
Hi, Chandra. So we do have patients that just barely got on devoted. They were on a different map, and they got off of that, and then they got on devoted, which has dental benefits. What they were told is that they have to pay in full at the time of service for any services, and then they have to submit the claim to the dental portion of devoted. We looked into it for the patients, and we're being told that as long as the service is covered, the dental insurance will reimburse the patient 50%. But in the same instance, the patient actually qualifies for senior dental. So it's not fair to the patient, but then how would we bill senior dental? Because then if we bill senior dental the full amount, and this happened it came up with dentures. So patient got upper and lower, and we billed everything, or they billed everything to their insurance, $3,000, right? Roughly. They got reimbursed 50% of that, but now we still have, in our system, it's paid in full. It wouldn't even create an invoice for senior dental, but they qualify for senior dental.
So do you have to show proof to this devoted, I guess is the name of it, which it doesn't sound like they're devoted. I just want to throw that in there. Do you have to supply proof, or the patient supply proof that it was paid in full before they will reimburse?
Yes. We've been told yes.
Okay, interesting. So could you Oh, devoted as a reimbursement plan.
Yes.
So is it an actual insurance company?
They're stating it is an actual insurance company. They have two separate plans under Devoted. Devoted Dental and Liberty Dental, which we're not contracted with. So the other the other information that you gave helps us with that. We won't have to bill them. But with Devoted, we are contracted with them. And we didn't know that at the time we were getting contracted that this is how that plan works.
Okay, so how about this? I'm trying to think outside the box here. So after that is done, thanks, Taryn. I pulled it up myself. All of us over here on this end are pulling up Devoted because this is really too bad they're doing this to them. And this is strictly through the maps, correct?
Correct.
Okay. Thank you, Eileen. You guys are always so thinking outside the box, and this is just off the cuff here. That's something I'd like to think a little more about because I think we would need to have proof. Is after they reimburse half of it, you guys could bill us the other half and then reimburse the patient, but we would need proof that that patient's been reimbursed. I don't know. That's off the cuff. So it's something that we would need to discuss because I certainly do not want to make it where, oh, you're on Devoted and the way they're doing stuff, we don't like and we're not willing to work with. So those seniors are going to have to suck it up. I do not want to do it that way.
Right. Yeah, we have patients that have both, and it's like, well, they haven't gotten reimbursed. Actually, they haven't even had the service yet. We just looked into it for them. But they know they have to pay it in full and submit their own claims. They won't even accept a claim from us. And then they'll get reimbursed, but they don't say what the timeline is. They don't give any more information than just that. So we don't even know what the timeline is for the reimbursement.
Okay, so do they have to, sorry for the questions here. It's just, I want to be able to think about this after we're done here. So does the service need to be provided or do they need to pay for it before the service is done?
No, it needs to be provided.
Okay, so that actually alleviates one of my concerns. Can you do me a favor? And Eileen, thank you so much. Coming from Eileen, it looks like other Medicare Advantage plans are going to the same type of dental coverage. It's just really kind of sad that you're trying to help out seniors in Colorado and people are creating barriers. If you can please send us, Angela, a email to our dental inbox.
Okay.
I want to ensure that I don't miss any of the things we've just spoken about. Let us know exactly the process that has to happen. And I previously was able to go through MSB and get MAP added to the senior dental program before. It was never part of it until I got it added. I'm wondering if there's something that we can go ahead and add for these seniors, especially knowing more Medicare Advantage plans are going to this type of item. Now, the thing is, are you all not going to want to do it because it's going to be more administrative burdensome on you that you then are going to have to reimburse the senior after we pay you?
We're really not sure how we want to do this. If we do it the way they're telling us to do it, that means we're actually paying the patient, reimbursing the patient,
Right.
more than what they paid.
Well, no, that's not true. Because if the person pays, if they only pay 50%, then that's how much you would bill. I mean, they are paying you. Okay.
100%. Mm-hmm.
And then you would bill us what that 50% is that didn't get paid after Medicare got done with it. So they wouldn't be receiving more money. You would bill us, and I showed you on the invoice, you can bill less than what the max payout is.
Okay. So
Um,
would this be an option then, Chandra? Could we only bill since they're getting upper and lower? Can we bill the one either or to the program?
No, you should be able to bill both. You know what? Send me an email. I need to discuss this. I need to,
Okay.
number one, wrap my head around it.
Okay.
I have that yellow brain, so I'm going to be looking outside the box, which I always do anyway. Um, hmm, yeah, let me see what I can think of and what I can do.
Okay.
Because this is, if every insurance company goes to this, it pretty much gets rid of this program if we're not allowed to help.
Right.
And they're already reducing dental again through Medicare. I'm getting perturbed just thinking about this. So thank you, Angela, for bringing this up. And I look forward to getting your email so I can start working on this issue.
Okay. Thank you very much. I
You bet.
appreciate it.
Looks like Katrina, devoted is sketchy. Good luck for patients to, in fact, get any reimbursement. Hard for seniors and providers to get any info from them since their reps don't know much. Also, the amount they allow could have already been used up for other non-dental. And good luck knowing that in advance. It's a real burden and feels like a racket. Interesting. Eileen, you don't have Devoted's fee schedule. And then Donna, it's hard because in rural areas to options for Medicare plans is limited. Sometimes there is only one or two options. So these are all options that are embedded within the Medicare Advantage plan. Okay, I'm going to let this go for now because my brain is all wrapping around this quick. And my staff know me well enough. I'm getting ready to go down the rabbit hole. So Eileen, I might be picking your brain on this because you know these Medicare Advantage plans inside and out.
The
This-
other thing, Chandra, that you need to wrap your head around, this is Eileen, is that some of these, which I think is Katrina's problem, also are contributing to it, is some of these plans are giving out these discount or these cards. They're like a food card or a dental card or whatever that has a certain amount of money on it. The person can use that card however they want. And so sometimes people use that card for dental services, or they think they can, which can work. But if they've used that card for groceries this month or to pay their Excel bill, and then they think they can also use it for dental, they're going to be also out of money. So that needs to go into our thinking here, Chandra, as well, with these cards, because that's also, I think, part of the confusion that we're looking at here. And I don't know how to sort it out. I just know that it's going to add to your headache at the moment.
I got Taryn over here. She's chatting me. She's finding all this stuff on sending it to me. So
Yeah.
I'm going to tell everybody now. And I know, Eileen, you remember, along with other grantees, that adding maps was not a we'll get it done tomorrow thing. So there was a lot of research that went into it. This just fumes me knowing that this is happening. So I am going to need to try to get as much information as I can. This is something we need to take to the Dental Advisory Committee and talk about. I'm really going to ask for you, the grantees, you're going to need to show. You're going to need to tell me what you show up to the Dental Advisory Committee meetings. You need to show what you've seen. If you're not able to make it, send me an email. So this is going to be stuff that is going to be coming down the pike, probably not tomorrow. You don't need to be sending me stuff except for you, Angela, and Eileen, please. But Oh boy. All right. We need to get going because we're running out of time. Thank you for bringing that up, and hopefully we can get this worked out. All right. Next slide, please. All right. Monthly invoices. A reminder that if they are not fully filled out, they will be rejected. And when I say fully filled out, you're missing the middle name. We have some, instead, if the person doesn't have a middle name, it should be put in as NMI. If you look at the instructions, invoice instructions, it tells you what to put in there if you don't have a middle name. If you put in NA, we're going to send the invoice back. All that stuff needs to be filled out. If there is incorrect information, so for example, you've done a date of service that is for 2030, we will remove that procedure. Any procedures that we remove, I will, one second here. When I say I mean Alondra. Any procedures that are removed, Alondra will minus those out of the invoice. She will send you an email, let you know what she removed, why she removed it, and what the new amount of the invoice is. If you are able to rebill that invoice, say it was due to let's say it was due to not doing the correct tooth number. Let's do that one. And you're like, oops, it should have been this tooth number. You can rebill it the following month. So that's not a problem. If they're removed, you can rebill them. But we will not pay on anything that is outside of the guidelines on that fee schedule. Right-hand side is dental procedure guidelines on that fee schedule. Rick has already supplied the link for that. You can get in there and look for it. Okay, next. So we pretty much have ran through the grant timeline reminder. The July 1st to June 30th annually is what the grant timeline is. Procedures completed on or before June 30th go against the fiscal year 25-26 grant amount and not the 26-27 grant amount. Grantee should not bill services completed July 2026 on the June 26 invoice or vice versa. Next slide, please. This is more reminder of the same thing. Data service can be billed in the month the Medicare Advantage plan payment is received. Just make sure you use the correct date of service. So what I mean by that is if you do the Medicare Advantage plan service on July 29th, you receive payment and then you bill HCPF in August, you still want to use that July date. You do not want to alter the date to August. You want to use the same date. Next invoice, next slide, please. This is a reminder. We already looked at the driver's license. We asked that you obtain the date of birth from their ID and also their name from their ID so we can try to keep track of the 20 different John Smiths that we receive. If the date of birth that we receive from you on an invoice is showing different from the one that you have previously sent us, and we have not received an email stating, hey, the previous one we sent was incorrect, can you please fix? That procedure will be removed because the date of birth does not match. We will let you know, and either you will let us know, oh, that was our error, we'll bill on the next one, or we should have sent you one. This is actually the correct date of birth that should be on there. Again, any questions, please raise your hand. This is kind of, we went through these a little bit when I pulled up the invoices. Adjustments. The majority of you know which adjustments I'm talking about. You accidentally billed something that, oh, the insurance actually paid for. So we need to remove that. If this should happen, you will send our inbox, Senior Dental inbox, an email stating the name of the patient, the service date, the date, or I'm sorry, the procedure code, and the amount billed. And please remember that this will need to be an encrypted email coming to us. Let us know that it was incorrectly billed and you need to remove that. What will happen is we will just go ahead and remove that off our system along with the history that we keep for all the procedures that are done. It'll be removed from there. And you will receive an adjustment the following month. So that amount will be added back into your grant amount, if that makes sense, because you are returning the money. Just received a question. If we billed the last 2 invoices without admin fee, but received more funds after the fact, can we send an adjustment for that? If you have the funds, yes, we can add that back into the invoice. You bet. For the new grantees, new employees, adjustments are pretty easy, but they can sometimes be confusing. Please just let us know and we can help you. We can walk you through that. Pretty simple. Please note that let's say that we are in August and you realize June, oh, you know what? We shouldn't have billed you for this since it's a brand new fiscal year. We cannot do an adjustment. You will have to send a check to PICPA to repay that amount. So just an FYI, since we're coming close to the end of the year. Next slide, please. Okay, Excel workbook. Guess what? I jumped ahead and went ahead and showed you all that. We will only accept the workbook that we send you. So we will upload a workbook into your SharePoint site. You either, everybody does it differently, it seems. Either one grantee will actually fill in all their information on each tab. We have others that will save and then submit a new invoice for July, then August, then September. Don't care how you do it. The big thing you need to remember, though, is however you do it, if there is an adjustment and you're having a procedure removed because you shouldn't have billed it, you also need to do that on your side. Because if you don't do it on your side, our totals are not going to match. And since we are working with limited funding, you need to ensure you do not go over your allocated amount. So please keep that in mind. The other thing is if you have a new employee that needs access to SharePoint, please send our inbox a note stating that you need to add an employee. On the other side, if you have an employee that has left, please email us within 5 calendar days of that employee leaving so they don't have access to the site. Especially since that has personal information in there. We are hoping to have the new invoices uploaded within the next couple of weeks. I want to be able to have those readily available for everybody. Once July 1st hits, you guys can start entering your stuff. I know some people do it every day, and they'll do it on a daily thing, where others will keep it somewhere else and then just upload it to the invoice at the end of the month. So I will try to have those sent. Once we decide the day we're going to do that and we upload it, we will send all grantees an email letting them know that you're going to receive your new invoice for the year. Please do not use the new invoice you receive for June of this fiscal year. It is for the new fiscal year coming up, because the rates will be incorrect. So. All right, next slide. And since I jumped ahead, we already went over the Excel workbook. Is there anybody who would like me to bring the Excel workbook up again and show them anything specific? And don't be afraid of your question, because you have it, somebody else might have it as well. Okay, next slide, please. Allocated grant amounts. For the new grantees and new employees, we have the ability to go in and actually move grant funds around. We are a special grant, and that is because it's general fund only, and we need to ensure all of those funds are used up. And I look for this coming fiscal year grantees fighting over that money, because everybody's going to need it. I am going to, sorry, Rick, I want to share this really quick just to show what they need to look for if that is done. Okay, can you see that?
Yep.
Okay, thank you. So if we go in and we actually say that you run out of funds and you need more funds and we reallocate you $3,000 or whatever the case may be, we will actually go into our invoice or your invoice. Taryn, did we decide that we were going to use their current invoice on there and just go ahead and update theirs, or were we going to upload a whole new one?
We have been just updating the one that's already out there. The only time that we uploaded the new one is when we had to do the reduction in November.
Good to know. Thank you. All right. So if you are given more money, or on the other side, you let us know we're not going to spend it, so we're going to give you $3,000 back, we will go into your invoice that we uploaded into your SharePoint. We will get in there, and this amount here, we will change. So that is the reason it is so imperative that when you go in, say that we tell you we had to remove this D0180 because you billed it a year ago and it's not valid because you billed it too soon, we have to remove it, that you remove that, because that's going to alter this amount, which then in turn alters this amount, which in turn gives you what your remaining dollars are. We've had instances at the end of the year where we receive an invoice and it's like, whoa, you're like $3,000 over where you should be. We can't pay that. What happens if that happens? You don't receive payment. And you cannot go back and bill those seniors for these procedures. This is something that you did. So please watch for these bills and the adjustments and ensure that we match. We do have one or two grantees that actually will check in. I don't know if it's like quarterly or what it is, saying, hey, this is what we're showing our current balance as. Do you match that? Send us an email, we'll let you know. It's not a big deal. Okay. Thanks, Rick. If you can go back to the PowerPoint, I'll stop sharing. All right. Can you go to the next one? This is just showing you what I just showed you, the update amounts where we will change them. So when you go to look at the PowerPoint, if you need to pull it up off the website, this is just a little more information of what we change if you don't remember what we went over. So that's just what we exactly talked about. Next slide, please. I am going to say it again. Please ensure that you track all allocated amounts every month. As a grantee, this is your responsibility to ensure that you know what your remaining balance is. If a grantee goes over that allocated amount, there is no assurance that HCPF will be able to pay that amount. We've been lucky this year. We've been able to catch a few, and there was some individuals that returned funds. So please be careful.
And Chandra, we had a question in chat a little bit earlier. It said, is there a limit per person?
Thank you for catching that, Rick. That is up to each individual grantee. We do not limit per person. We let you decide on what you're going to do. Some people limit $1,000 per person. Others will limit what the procedures are to get those out of the way. So they'll do the preventative, see what money they have left, do the emergencies, see what money they have left. So sometimes grantees will do it based on the money per person, and sometimes they will do it based on the procedures. So you're able to choose how you want to do that. My thing I want to say is, please don't give certain procedures to one person and not another. So what I'm saying is if you have somebody who has the same procedure that is needed by someone else, but hey, I know this person, so I'll go ahead and do it for you. If you're going to do it for one, please do it for across the board. It can be more difficult now that we have limited funding to do 1,000 per person because you're looking at treatment plans. I just want to say, just be careful on how you do that and try to make it where it is as fair as possible across the board, especially now that we have limited funding. Does that answer it, Michael? So it's your call. You bet. All right. And again, the patient can't be billed more for what their max copayment of this happens. This actually is in statute. It's law that they cannot be billed more than the copayment. So I just want you to be aware of that. Okay. And next slide, please. And we thought the quizzes were over. Where on the invoice file should grantees look at to view your allocated grant amount total? A, invoice instructions tab, B, summary tab, C, monthly tab, or D, SharePoint tab? So Taryn, this is kind of a trick question.
It is a little bit, yeah.
Obviously, I didn't do the quiz questions because I stepped in for Alondra. So I'm going to have to tell her we're going to have to add another one because good job. Actually, a couple answers are correct because it is going to be on the summary tab and the monthly tab, B and C. Because if you remember up in the corner, Karen had told you that is going to be an accumulated balance and not just for that month. So you can look on both the summary tab and the invoice tab up in the upper left-hand corner. Any questions before we move on? Okay. We are running out of time here. So on the Senior Dental Program Annual Report, once again, this is due September 1st. HCBUF will let you know what information will be required for the annual report. And actually, we receive a lot of your information that we need for our annual report from your invoices. So we will send you limited questions that you need to answer, which is kind of nice. So that is one of the reasons we need to ensure that your information is accurate when we receive it off the invoices, is because that is what we turn into legislature. Next slide. Thank you. Audits. These are always the fun ones. Oh, we got a question. Eileen, when will you send us the questions for the September final report? I usually send those out in July. Yeah, it's usually around the first portion of July. They're not real difficult questions, and if they're not questions where you're going to have to go in and pull a lot of data, you know that, Eileen. So it's a lot of times going to be more of we've received complaints on something, or you actually might see something about maps on this one, asking some questions on what you've seen. But yeah, usually in July. Audits and spot audits will be performed throughout the year. HCBUF will randomly select the files for each grantee. We will only do a spot audit normally is if we have received a complaint and then we look and find out, oh, you know what, you have been billing wrong, or you are overbilling, or whatever the case may be. If that happens, that's when a spot audit will happen, and we will actually pull either certain files or possibly all files that contain certain procedures. It just really depends on what we've received and what we've realized. All files selected will be reviewed to ensure the patient didn't have Medicaid, Health First Colorado, at least 60 years old. They had income at or below 250% of the federal poverty guideline, and that they are a Colorado resident. Please do not include anything regarding lawful presence, because we do not check for that. Immediate dentures. On the provider website, there is a form for immediate dentures that must be signed by the patient and by the dentist for immediate dentures. All immediate dentures are pulled into the audit. The reason for this is because of the failure rate of immediate dentures. And you're not allowed to get another denture for 5 years underneath the program. So this is to ensure that the patient is aware. That is available, like I said, on the website in both English and Spanish. Next slide. We will look for ledgers that match the invoices submitted, proof of age, ensure that the invoices were not submitted prior to the procedures being completed. So we'll look at dates, we'll look at patient co-payments, accurate patient information, and then once again, if the immediate denture form, if applicable, was signed. Next slide. If there are findings, we will issue a corrective action plan, and the grantee will be required to sign the CAP form addressing the findings, how the internal controls of what we found will be changed, or if they've already been changed, you can also address that in your response, and the date of the implementation of the new process. Any questions on that? I know probably for the new grantees and employees, it might be something you won't have questions until we get into the process. Please note, once again, that inbox, you can always ask if you have questions or concerns. Please note that if you are in the middle of an audit and you are working with Alondra and she has found some stuff, you cannot contact me trying to find things that can be changed. If you're in the middle of an audit, unfortunately, and there are findings, you're going to have to do a corrective action plan. I will not, unless there are extenuating circumstances, I will not authorize you not to do a CAP. So please keep that in mind. No shopping allowed. Okay, next slide, please. If there are repayments required, you will need to submit a check directly to HCPF because this is not within the same fiscal year. It's from past fiscal year, which means that money cannot be moved around. You actually will have to send in a physical check. These will be on items such as double billed procedures, procedures billed on an invoice but not showing on the patient's internal ledger. Patient is not above 60. If that is the case, every procedure you've done will have to be reimbursed. And if they have an income that's above the 250% federal poverty guideline, all procedures you've done will have to be reimbursed. Are there any questions on that? Okay. Required repayments. Another item we'll look for is if the patient was charged a copayment that was over the max copayment. So you will receive a finding on that, but we will have to receive proof. So whether it be a check with the person's name on it, whatever the case may be, that the person was given a reimbursement. We have to have that because it is actually, you're actually breaking the law. This is in statute. You cannot charge the patient more than that copay amount, that max copay amount. Any questions on that? I know that people get kind of scared of that because you're talking about money out of your pocket, but that's what it is. Okay, next slide. Questions? I'm going to keep rolling through because we are running out of time. If you have a question at any time, please raise your hand. We will review the documents as I previously stated. We'll look for if you used a hospital discounted care card, we'll ensure that it's unexpired. Again, proof of age. That HCPF web portal verification document that we spoke about. A copy of the Medicare Advantage plan card, proof of income, grantee ledger with billed procedures. This, folks, next slide, please, is a picture of the web portal printout. So this is all you need to do. Go in, you don't see anything, print it off and throw it in the patient's file, and we will work. That's what we need. Next, we already went through the hospital discounted care card. So if you can go to the next slide. Here are copies of examples of insurance cards. The reason I suggest that you have these in the patient's file, it is showing that you are doing your due diligence to try to find out what they have and if they have a supplemental. Some cards show supplementals, others don't. Sometimes you have to make a phone call. It really is just, I'm finding no rhyme or no reason with any of this. It's just based on what the insurance itself does and provides. Next slide, please. Income documentation. I'm sure many have seen the Social Security Administration receipt of what they received. And then I had talked about if somebody wants to self-declare, your note that you type up can be as simple as this. Just, this is what I make per month that I receive from Social Security benefits, and have them sign it. That shows your due diligence, that if the person didn't have the documentation to submit, that you got a signed document from them stating this is what they make. Next slide. When we talk about ledgers, and either, I mean, everybody's ledgers look different, it seems. Some people also will use the dental form for all their stuff. We receive that. We do need to receive a ledger, though, that shows what the patient paid as far as a copayment, the procedure code, any other information, tooth numbers, quadrant, whatever is showing that. And that actually will be part of your dental procedure guidelines and what you need to provide us. So basically, the information you send us that is in the patient's file needs to match the invoice you submitted. Same tooth number, same date, same procedure code. All of that information needs to match, or it will be a finding.
And Chandra, we have a question in chat. Do we use gross income or net?
You use gross. You bet. All right, next slide. And we are not done with the quizzes. Grantees are required to submit repayment to HCPF for an audit finding, except for double billed procedures, B, procedures billed on invoice but not showing on patient's internal ledger, C, web portal verification form, D, no proof of age or not 60 or above, or E, income above the 250% FPG. All right, looks like we have slowed up. We had, it's like 60% that chose C, and that is correct. You do not have to resubmit. You do not have to submit repayment to HCPF for a web portal verification form. Everything else listed on here that is found in a spot audit or in a normal fiscal year audit will have to be repaid. All right, this is an audit process flow chart. This is actually located on the website, at least it should be. Can we verify really quick, Taryn or Rick, is that on the website? If not, we need to add this. This actually will help. I think this is a great resource for people that are new and just learning the audit process on what we look for and what happens when something is found. If it's not on the website, it will be. All right. Next, any questions? I kind of running through. Of course, I went out of order and showed you guys some stuff I shouldn't have prior to the slide. All right, next slide. As far as hospital discounted care questions, if you have any questions, please let us know. Seniors can use this. They can qualify for hospital discounted care if they are on Medicare. So this is a great resource for seniors, especially if they only receive Social Security. They can receive help with their hospital bills. So please send in. If you can, Rick, did you already supply? Oh, you did. Rick supplied the website for hospital discounted care, and there'll be an email on there as well if you have any questions that can go to them, and they'll be able to answer anything for you, or if you want to give it to one of your patients. All right, next slide. Here is the HCPF Senior Dental Program inbox. Rick just put it down in the chat as well. And then when you get to the end of the slides, if you need to pull them up from the website, next slide, there you go. There's our website links as well. And that will take you to your, when I say your, I mean we have two out there. One is for the patients of the program, and the other one is for the grantee of the program, which will have a ton of links for information for you. And thank you. I want to thank everybody for attending. Oh, thanks. I love to hear we're a highly functional team. Sometimes I'm not too sure of that some days. And it's mainly due to their boss. So I appreciate that. So I know we have a couple of new grantees. It can be very overwhelming with this being a grant program. And there's a lot of rules because it is a state grant program and you're dealing with state dollars, and that's the reason it is like it is. So it sometimes can be administrative burdensome. We try to alleviate that, but there's some things we still have to put into motion due to where the money comes from. We are always available for you. Like I said, any questions at any time, please let us know. We do have a couple of minutes left, and I do have time past 3 o'clock. So I'm actually, if you can take the slide down, Rick, I am actually going to leave it open for questions that you have come up with that you just haven't asked yet. I will not just leave you guys high and dry and say, see you and have a great day. I'll wait around 5-10 minutes, make sure there's nothing else that anybody needs.
I didn't know hospitals.
So Chandra, it's Eileen. Do you want to just schedule a separate time to talk about the verification since you no longer have access to the CBMS stuff? Do you want to just set a separate time to talk about that?
Now, I don't have access right now. So it's going to be like 10 days before I get my access back.
That's fine.
So I didn't make it, I hope I didn't make it seem, it sounds like I might have, that I'm never going to have access again. I will.
Okay.
But for right now, until I receive that back, is there a way that
if I shouldn't have to verify anybody for the next 2 weeks. I just thought that whole system was going to go away the way you had mentioned it.
No. It's just,
okay.
yeah, my access, OIT, I guess, I don't know. Maybe I made somebody mad and they're like, you're out of here. I don't know what happened to my access. So
Who knows?
It's one of those things. So once I get it back, I have been contacting people that are like, hey, we're not able to get in, letting them know, hey, if you already checked Medicaid, you can go to that area. It's the same thing.
Right.
So I don't know if you guys have Medicaid access. Do you have that?
I do not.
Okay.
But if I happen to have one person that I need to verify over the next few weeks, I'll just call somebody and
Okay.
I'll be fine.
That
I
sounds
just thought this was going to be a big issue for the future.
No. It's right now, it's just I don't have it, but I will be getting it.
Perfect. Okay. Thank you.
You bet. Okay, will you be providing an update regarding the devoted plans and how to work with them once you have additional for regarding these plans? Yeah, Sylvia, so does that mean that you guys are dealing with these as well?
Yes, we do. We've had not so many, but I did reach out to that company, and just like how the other person was saying, the patient has to pay everything up front. They're allotted a certain amount, but they also share it between like vision, chiropractic, massage, therapy, and we don't know how much is being used, and so it's so confusing. And yeah, so
All
it's
right,
been a couple patients, not many, but I have seen it.
Taryn, this sounds like the MediShares, yeah?
Kind of does, yeah. So Medishare plans, a lot of times they won't allow the medical provider to bill them directly. The patient has to submit it, and then
Hmm.
they'll pay the patient directly, and then that's a whole thing, between the hospital and the patient to get that payment. So I don't know if maybe we handle it the same way that we do with discounted care, but I don't know.
Okay.
We'll have
Yeah.
to, we're definitely gonna have to look into it and see.
Yeah, we currently deal with this with hospital discounted care. That's within our unit as well. So I got a lot to think about. I have an idea of how I want to do this, but I don't want to say anything until I know it can be
Okay.
done. But we
Hmm.
will work on this. I'm not going to lie, it's probably not going to be a quick process. Um,
Okay.
so, because we need to go through probably dental advisory committee. I really rely on the dentist on that committee to help us make decisions when it comes to certain things, not just the dentist, really everybody on the committee.
Hmm.
Um, and plus, it is a great resource for us to be able to get stakeholders' input um, on something. Somebody might know something that somebody else don't. So,
Right. Okay.
but yeah, it's not something that we are going to put on the back burner. It's something that I actually will start working on right away.
Okay. Well, thank you so much. I look forward to seeing how we could help these patients, because it does seem unfair that they have to pay everything up front, and then they give them a certain time frame of when they have to submit that claim. We can't submit the claim. And then from there, how do we even track it? If, it's just so many questions, I guess. We don't know how to
Well,
work
yeah,
with
and then the
that.
patient actually could come back and say, I never received reimbursement when they
Right.
did.
And how can
So,
we prove it? How can we find it? How can we, I don't know. Yeah. Okay.
yeah. Okay, great. Thank you.
Thank you, Chandra. Thank you, everybody.
All right. So, from Anna, I think I just want to make sure we will be using our regular Excel spreadsheet. Okay, it is a regular Excel spreadsheet, but everything has to be input on ours. So, um, I want to show you all something because some people, if you try to highlight your entire Excel workbook and try to paste it into ours, it will not work because we have items that are secured and you cannot put anything over that column. Um, Rick, I'm going to share my screen really quick here. I don't know why I'm telling you. I guess I'm just going to let you know, sir.
Thank you.
Yeah, you betcha. I'm here for you. Okay, let's see. All right, let me go to this. If you have an Excel book that you type in all your information on and you're like, hey, I'm going to go ahead and copy. And you know what? I don't think one second here. Nope, that is protected. Okay. This is going to come up because some of these cells are locked. So you are not going to be able to do a copy and paste, even if it's from your Excel. So a little trick of the trade here is take from the patient's last name over to the procedure code, do a copy there, do a paste, and then it fills all of this in. And then you're just left with this other stuff. It's because of the columns being locked, but at least this alleviates a lot of hand coding in from here, and you can do a copy and paste. So hopefully that helps you out a little bit, especially if you are putting your procedures down on a different Excel sheet. Stop sharing here. Does that answer your question? Is that going to be a problem, Anna? I'm thinking you're new, yeah? Yes, you'll need to copy in on this.
I'm not new, no. I've been working with dental for quite some time now. But we share our Excel sheets throughout, I guess, pretty much all the Valley-wide clinics. They're separated by clinic. So we each go in and enter and update our own information. I guess what I'm wondering is, do we need to paste all that information that we're putting in our Excel sheet into this spreadsheet that's yours?
Yeah, if you want to be paid, because this is what needs to be submitted to us.
Okay.
Yeah. So however you guys decide you need to do that as a group, that's up to you all. But yeah, all of the procedures need to be put on this specific thing. And that is just because of keeping track of the grant amount and all the other items on the Excel. And then plus what you guys send us, we actually put into our database so we can keep track of what patients you all have seen, what procedures they've had done, etc.
Okay, thank you.
You bet. All right, we are working on cleaning up our list of dental providers. What is the process and what do we send to them if they are interested in being a provider? Okay, so great question. So when you say working on cleaning up your list of dental providers, are you saying old ones that you don't deal with anymore, Brenda?
When I came in, it was initially at the beginning of when we were trying to get our providers, and we didn't have like the old list. We kind of didn't know where we were at.
Oh, Brenda with Northeast.
Yeah, that's
Hi,
me.
Brenda.
Hi, how are you? I've been absorbing all of this. So just and since then I've talked with Shannon across the hall. She does CSBG, and so I got, I have a list of their providers, and in the meantime I found an more updated list from over here. So I just wanted to reach out to them because we reached out to them and then we heard back from like one of them.
Okay.
And so I just want to reach out to all of them, and I just need to know what I need to get to them. What kind of information are they needing, and what do we need to have on hand to make sure that we're, where we need to be?
Great question. All right, so I'm going to start with what you should send them.
Okay.
You want to send them the fee schedule with the new rates. They need to know that they're not going to get paid with the old rates. So you're going to want to send the fee schedule with the new rates. We will get that sent out to everybody once MSB approves it. Oh, man, we don't want to wait that long. I see no reason for MSB, Medical Services Board, by the way. I try not to use acronyms. Medical Services Board, we see no reason why they are not going to approve it. We will get that schedule sent out. You guys are going to be receiving, Taryn, if we can, so we don't forget to tell Alondra this, I think I will send that fee schedule out to everybody when we upload your new invoices so you have them.
Okay.
Make sure that they get that new one. You're going to want to find out that they're willing to accept those payment amounts, first of all, that we pay for procedures. If they're not willing to accept those, then I mean, there's however you guys work it, but if they won't accept them, then I guess you can't use them.
Right.
The other thing is, I know a lot of people, I do suggest an MOU,
Okay.
just stating that they are willing to accept the rates that the program pays.
See, and that's what we sent out. We kind of went off of the list that we found and we sent MOUs out and we got one back. And I was like, that is not going to cut it.
Yeah, so I mean, you can always follow up with a call, because I mean, in all actuality, and I know you've been doing this because you and I have spoken before, in all actuality, that is the responsibility of grantees is to reach out,
Right.
and reach out to seniors, but not only them, but if they are a person or an entity that does not do the dental work, it is your responsibility to reach out to find dentists that will. So I would say call, and if they have questions that you're not able to answer, send us an email and we'll help you answer those.
Okay. Okay.
The other thing that you need to do is ensure that those dental providers are within good standing of the state. That is something we now check. I'm not going to lie, I was kind of blown away about some of the stuff we found when we started checking.
Okay. And how do I check for that?
Actually, we have a link. It's for the Secretary of State. You can go in and find whether they're in good standing, or DORA. We will get that link to you, and that should always be checked prior to adding that provider onto your list. And when you get a new provider, since you've already sent in your application, you get a new provider that's willing to work with you, you've checked them, they're good, just send us an email and let us know, hey, we need to add this provider to our list.
Okay.
Okay. So, yeah, and then as the questions come up, feel free to let us know. I know that you guys kind of got left in the lurch on this.
Oh, yes. Oh, yes.
Yeah, so please just reach out if you need help.
Okay. That sounds great. Thank you so much.
You bet. Did I miss anybody, Rick?
Yes, there was one from Michael. We are new, do you know when we will get access?
Okay, sorry about that, Michael. Actually, when Alondra gets back. Or no, Rick, can you do that or not? Can you give access to SharePoint?
I can. I
Okay.
just need to know the people that need access. So if they can send an email with the emails of the people that need access, then I could add them to SharePoint.
There you go, Michael. Just go ahead and send it to that inbox for Senior Dental. Look at that. You ask and you shall receive. So send that to us, and Rick will be able to get you all set up. I do suggest that you do a test to ensure that you can upload your items to SharePoint, just to ensure everything's working correctly and something don't happen at the last minute. Thank you, Rick. All right, any other questions? Obviously, if you are not wanting to ask here, you can send us an email. That is not a problem. Or if you think of it later. Michael, you're new. There's a couple other people that are new with the program. Please feel free to always send us your questions, especially when it comes to those invoices. It's better off just to ask us the question now instead of waiting until the last minute and then find out you can't receive payment because of something. We're always readily available for anyone who needs assistance. And I'm going to give this about 3 more minutes. And if no one has questions, I'm going to go ahead and log us out of here. I want to thank everybody again. Great questions. And I can't thank all of you enough for being willing to accept the program as it is with lower rates now. Some administrative burden with paperwork, but assisting our Colorado seniors that the majority of them are in much need of this. All right, folks, then I'm going to go ahead and log us out of here. Thank you again. Have a wonderful rest of your week.